Good morning, everyone. I'm Phyllis Foxworth, the Senior Manager of Advocacy for HDSA, and I want to welcome you to our second advocacy session of convention. Met many of you yesterday where we talked about the legislative process, how a bill becomes law. I shared with you the legislation that we're tracking and gave you some education on how you can speak about that education. And today we're going to share with you three exciting campaigns that we have that you can get involved in, and we certainly hope that you'll want to get involved in. I'm going to scroll through all the disclosures. I don't have any. All right. So those of you who were here yesterday, we shared with you what our key areas of advocacy are. They are to increase access to care, which we talked about yesterday. And if you look at your handout on your talking sheets, there's the legislation that will increase access to care. And then we also talked about reducing financial burden. We also have two campaigns that we did not discuss yesterday that we'll talk about this morning that can speed innovation in the development of new therapies. So without further ado, I'm going to introduce Tracy Toscano. She has been involved with HDSA advocacy for well over 14 years. She is our advocate extraordinaire. She's going to talk to you about our campaign, which we call our August recess, our August Congressional Recess in District Meeting Campaign. And I'm going to, there we go, there's the slide you need. So this relates to all the training that you got yesterday in my conversation about how does a bill become law, what is the legislation that we're tracking, the importance of who your legislatures are. And so she's going to share now everything you learned yesterday and how to put that into action with this campaign. So welcome, Tracy.
Good morning. Thank you, Phyllis. We are live streaming, so the pressure is on. My name is Tracy Toscano, and I am a volunteer congressional advocate. I've been advocating for actually 12 years. Some of you might know about the HD Parity Act. That's been my main focus. But we have some new things to talk about. Who is coming into one of these advocacy meetings for the first time? Oh my gosh, okay. Great, well, welcome. I will get started. So we need your help. And you can help somebody living with HD right now. Today, you can help somebody. So if you feel like you have no hope in your fight with HD, I'm telling you right now, you can help somebody today. And that is talking to your members of Congress about HD and improving the lives. So we are coming to a close of our Congress. This Congress is coming to a close in November. And our elected officials will be up for re-election, and some will be resigning. So it's a big opportunity to get involved. The HDSA is supporting 8 legislative bills in Congress right now. So our campaign is to talk to your member of Congress while they're home in August. I didn't realize this until Phyllis mentioned it yesterday, but it's a law that our senators and representatives have to go home and meet their constituents in August. And this is a great opportunity to educate them about HD and how it affects you on a daily basis. So they want to meet you. So come join our cause. We are a small but mighty group caucus that meets every other month via Zoom. It's been the most rewarding experience for me to be a part of. I'm excited to be an advocacy leader, and I hope that maybe I can persuade some of you to join our cause and to sign up to meet your member of Congress. So your help is vital to our success. We need you to come and support our legislation. You heard about the legislation yesterday. You have the packet in front of you that goes over it. You can take that with you. And if you are interested in meeting a member of Congress and you're a little nervous on how you're going to do that, we have some state captains in limited areas that can help you. I am one of them, and we have several in the room. Can those state captains please stand up so everyone can see who you are? So this is our caucus. We're, like I said, a small but mighty team, and I'm so proud of everyone and the work everyone's been doing. It's very exciting to get emails from my team here telling me, hey, I got a call back from a senator, and they're going to meet me. So it is exciting, and it's very rewarding. So has anyone ever been to the HDSA Take Action webpage? Okay, good. Well, that is a resource for you that is full of great information about joining our cause. You can learn how to contact your member of Congress, how to schedule a meeting with them. You can find sample emails on how to talk to your member of Congress about HD. And you can also download all the current legislation and any leave-behinds that might be there. So we are asking you to join us and get involved and take meetings with us. So if you were to go to the webpage, you will see this page. You'll immediately put in your name, your email, and your street address, and up will pop up your members of Congress. If you don't know who your senators are or your representative, you will find that information here by just putting in your zip code. Yeah. And we also list our state captains on the website. So all our names, email addresses are there. I cover the Delmarva Peninsula, New York, and Florida. So here's what we need you to do. Once your state captain has talked to you about when a good time to meet your representative and senator is, they will set up a time, whether that's in person or online. If you're near your state capital, you can meet them. You can drive and meet them in person, which we always recommend. It's fun. You get to see them in action, so that's always exciting. But a lot of times you can meet via Zoom right in your own living room, so don't feel the pressure to have to drive there. But what we need you to do is once that meeting's in place, we need you to show up on time. Our members of Congress are very busy people, and we do not want to keep them waiting. We want you to select one piece of legislation that you want to discuss out of the 8 pieces that we're supporting, and come prepared with your story. If you have pictures or a short video, show them. Show your members of Congress what your life is like, or your family member's life is like with living with HD. Show them the before pictures. Show them at family vacations and holidays. Show them what their life is like now. Tell them about the struggles that you have with HD. Let them know about what HD is. Oftentimes, members of Congress will tell me, yes, I've heard of the disease. And maybe they don't, but they don't want to tell you that. And I always like to remind them, HD is a neurodegenerative disorder, and it affects you in your prime working years. And that's always important that members of Congress know that this is a prime working years disease. These are the taxpayers and the people that are the foundation of our nation. So we need them to stay healthy as long as possible and with their families as long as possible. So once you tell them about your HD story, you're going to ask them to co-sponsor your bill. And co-sponsorship, as Phyllis talked about yesterday, is really important because when you have a member of Congress co-sponsor your bill, that means they're backing it. That means they are supporting that this bill becomes a law and will be signed by the President of the United States. And when that bill becomes law, then those therapies and all the legislation will help your family member immediately. You know, and that's so amazing that you can be the person that makes that happen. And it's so rewarding, it really is. After you ask them to co-sponsor the bill, You're going to give them their leave behind information, talking about the bill, your contact information. You can leave behind your photos if you'd like. And then you're going to thank your member of Congress. It's always important to thank your member of Congress for their time. Once your meeting's done, you're going to follow up with an email, again, thanking them for their time and pleading with them to co-sponsor your bill. I always like to recommend people to use social media to spread the word, use hashtags whenever possible so that your member of Congress can see this information and get it out there. And hopefully they'll share it with their colleagues. So people oftentimes ask me, do you have any tips or tricks? You've been doing this a long time. What do you recommend? Should I wear comfortable shoes? I'm like, eat, drink, get some hydration in you. Because these are exhausting meetings, and it's overwhelming, and it's scary to talk to a member of Congress. I mean, these are big people making big decisions. So I have some mentoring, helpful advice. First of all, reach out to your state captains. Reach out to me. I'm more than happy to help you at any time to set up your meeting, guide you, and maybe calm your nerves. And I will find people, like my friend here, Amanda, who lives in New Hampshire. We'll find other New Hampshire people who will join our cause, and we will designate a person in those meetings so that it's not overwhelming. You don't have to do all the work. Maybe I would share the legislation, and maybe Amanda will tell her HD story, and maybe we'll have Joyce ask for the co-sponsorship so that it's a group effort and everyone's heard. Always treat your member of Congress with tons of respect, always thanking them for their time. But most importantly, be sure to educate your member of Congress about HD. Always bring it back to HD. Always, always, always be telling them about this disease. Nobody talks about it enough, and they need to know about it. And you need to be ready for questions. That's not always easy to do, but the best you can do is know about HD. But don't be afraid to say, you know what? I don't have the answer for that, but I'm going to get back to you. And they're okay with that because they don't want to hear anyone lying. It's okay to get emotional too. If you cry, it's fine. They might cry too. It's okay. So don't ever feel like you can't be yourself and show your emotions. It might help our cause, actually. And finally, always remember, these members of Congress, they work for you. You employed them because you elected them. You put them in office. So be persistent. Be forceful about your emails. Reach out. So when you are done with your meetings and you leave and you're following up, after Election Day, we have a session called Lame Duck. And for those who don't know, lame duck is when a member of Congress is either retiring or maybe they didn't win re-election. So the time between the day after Election Day to the end of the year is kind of a limbo period. And what a good time about what this campaign will do is that this is a great opportunity for members of Congress to leave a legacy, a passion project perhaps, that they can not have to work within their party lines. They don't have any favors to make with other people. They don't have any allegiance, and they have no political vendettas. And they're more likely to support your bill during this time because they want to leave on a high note. So it's a really great time for us to get our word out. So going back to meeting follow-up, sometimes you may hear a non-response from your member of Congress. A non-response is just that, non-response, and that's not good enough. So if you do hear a non-response, be respectful, be polite, but ask again, I need your co-sponsorship on this bill, and keep following up. I always like to tell people that I, in the past, would leave Friday mornings every week to do my follow-ups. Hi, it's me again. Will you co-sponsor my bill? So it's always good to stay on top of them. But if you do receive a response you do not know how to answer, reach out to me. You can even reach out to Phyllis if it's a very big advocacy thing that's beyond our control, my knowledge, she may be able to help you with, and ask for help, and we will be more than happy to help. But yes, be persistent. They are busy people, but be persistent, but be respectful. And finally, if you'd like to join our cause, we're always looking for people to join. We have a webinar coming up in July. You can log on here and get more information about our webinar, or you can reach out to us on the state captain's page and reach out to Phyllis and join our cause. Like I said, we meet for an hour, about an hour, once a month, or once every other month.
No, it's every month now.
I'm sorry?
It's every month now. Because we're trying to get the people involved.
What, has it been every month or so? So we are, well, okay, so we are going back to every month now. I should probably know that. But yes, we are having one in July. So that's it. That's all I have for you guys. And take the packet with you and review. Does anybody have any questions? Oh, we're good. We're going to wait to the end for the questions. Okay, no worries. All right, thanks, guys.
So thank you very much, Tracy. And I just want to reiterate what she said, that it's our goal during the month of August, when our members are home, that we schedule meetings with 18% of those members. So there's 465 members of Congress. I'll let you do the math. But folks, it's very doable. And with your help and with the support of the state captains, we're here to help you to schedule those meetings and talk about that legislation. And as Tracy shared, that packet that you have, all of that information is on the HDSA Advocacy Hub. You can download it and you can share it with your friends and families. So please go ahead and hopefully you'll join us in this effort. I'm going to move on and talk about, as I shared at the beginning, our advocacy focus was around access to care and reducing financial burdens on families. A lot of that advocacy focus is focused on legislation. But now I'm going to talk to you about the third area, which is speeding innovation in development of new therapies. So many of you were probably at the research forum presentation that we had. And so this kind of builds on that. It talks about how you, though, can get involved in advocacy efforts to speed innovation. Okay, so HDSA is committed to improving the lives of everyone affected by Huntington's disease as we work towards our vision of a world free of HD. One key strategy is to raise awareness of the urgent need to accelerate the development of new treatments to those regulatory decision makers and medical product developers, while informing them of the community's preferences and needs. So again, you heard this morning in the session on research, all the great work that's doing, but we need to make sure that your needs are being considered and collected, and that we're informing them of your needs when they're developing these new products. So you can support these efforts by getting involved to provide the FDA, researchers, and medical product developers about the challenges of living with HD. This input can inform the FDA's decisions both during the industry's drug development process, like you heard this morning, and during the review of new drug applications. And you do this by informing the FDA and those medical product developers your perspectives on preferred treatment outcomes and wellness priorities, challenges in participating in clinical trials, the benefit expectations and risk tolerances you're willing to take in new therapies, and as well as caring and supporting someone who's living with HD. So the first campaign I want to make you aware of is the Huntington's Disease Symptoms and Treatments Impact Survey. When you take this survey, you will be informing the FDA medical product developers and researchers how you describe the challenges of living with Huntington's disease, how you describe the challenges of managing symptoms, and how you define the value of new treatments. So all responses are completely anonymous and confidential. HDSA does not collect any personal information in this survey. But your participation is extremely important, as the survey results will be shared with the FDA at an externally led patient-focused drug development meeting. And that was for those of you who were at the opening ceremony. Louise talked about that meeting, and I'll get into that a little later. So the results of that survey will be shared at that externally led patient-focused drug development meeting. It'll be published in the Voice of the Patient report, which is an FDA report that they host on their website that summarizes that patient-focused drug development meeting. And so why is that so important? Because researchers and medical product developers go out to that website, they download that Voice of the Patient report so that they can understand what the community, what the patient community is looking for. The survey results will also be published in academic journals and presented at other HD conferences. So again, this is an opportunity for you to get your perspective and your desires and wishes out there in the public domain. So the survey will be available in June, and it will be broadly distributed. But again, another way that you can help is not just taking the survey, but we want to have as many responses to that survey as possible. So when you take the survey, please be sure that you're forwarding it to other HD families. So the survey is comprised of 6 topics: demographics and your experience obtaining a genetic test or a diagnosis. We also want to understand the impact symptoms and current treatments have on your life. So as new therapies are developed, it's important that the FDA understand what your tolerance is around the risk and benefits associated with new therapies. Equally important, since the FDA provides guidance to medical product developers around the design of clinical trials, it's also important that we share your perspectives on the challenges of participating in clinical trials. So we're asking HD families to share a lot of information with us. The survey is designed to enable you to provide thoughtful reflection on your responses. There's no time limit for taking the survey, but it'll probably take about 40 minutes. But it doesn't need to be done all at one time. When you log into the survey, it will remember where you left off. You can leave and log back in. It will remember your responses. And the good thing is that you can also go back and change your responses. So after reflection, I'm taking the survey, you may think that, maybe I want to change that answer. You can go back and do that as well. As I said, the survey will serve as a foundation for an externally led patient-focused drug development meeting. But before I go in and talk about that campaign, so that our first campaign that I will share with you is the survey, and I hope that all of you will participate in that survey, because it is definitely the opportunity for you to share your perspectives rather than having people tell you what your perspective is. So before I talk about the second campaign, which is the externally led patient-focused drug development meeting, I just want to take a step back and kind of share with you and give you some grounding on the roles of the community, the FDA, and product developers in the development of new therapies. I'm sorry, I was not clicking through any of these slides. That's what happens. That's what happens when the slide is not, when you don't have it in front of you. So I certainly apologize that you did not see any of that. So what I want to share with you is that what I've been talking about is that your perspective should be front and center. The paradigm shouldn't be the other way around, with the medical product developers and the FDA and researchers telling you what you want and desire, you need to be telling them. So we believe that the innovation advances in therapy must have the patient at the center of any framework. The role of the patient community is to be the voice of the community and provide invaluable insights into the needs and preferences of therapeutic interventions. Your role as expert, and you are the expert, your role as expert of your own condition informs medical product developers about the therapies they are researching and developing, and informs the FDA on whether those priorities are meeting your needs. So again, I'm just going to keep emphasizing this, that it's our responsibility to tell medical product developers, to tell researchers, and tell the FDA what our preferences are. If we don't, we're allowing them to make decisions for us. So what is the role of the FDA? The FDA protects the rights and safety and welfare of people who participate in clinical trials, and that's really a critical aspect of their mission. They oversee clinical trials to ensure that they are designed, conducted, analyzed, and reported according to federal law and to best practice, to best clinical practice. So the FDA guides and fosters drug development by providing scientific and regulatory advice and direction to medical product developers. So what is the role of medical product developers? And this is really important. I think that this is a confusion that many people might have. The FDA does not manage clinical trials, folks. They don't design clinical trials. Trial protocols are, they don't design the trial protocols either. Trial protocols really are the documents that provide the background and rationale for why you're doing a clinical trial in the first place. They provide the information about conducting the study, highlighting the specific research questions that are addressed, and taking into consideration ethical issues. So when seeking approval from the FDA, medical product developers submit a new drug application, and they provide them with data around the safety and efficacy of that new therapy. This includes the endpoints used to gauge whether the new therapy is effective. And that is the heart of what I'm getting at. That is why it is so important that we put the patient first and that we inform the FDA on what your preferences are. And that's where taking the survey will really be a big help at that patient-focused drug development meeting, where you, the community, have told us what your preferences are in treatments, outcomes, what your tolerance is around risk and the benefits. This time I remember to advance the slide. So, the FDA has several programs to collect this invaluable patient information from the community. And so there are two different types of programs that I'm going to talk to you about here today. The one are ongoing committees, and the other are one-time meetings. So the ownership of ongoing committee meetings resides with the FDA. They solicit applications and recruit patients and family members to serve on these committees. The meetings are generally closed to the public, but the public is informed about the work of the committee through meeting summaries that they would post on the FDA website. So there are two meetings in this category that are comprised of patient advocacy organizations. The first one I'm going to share with you is the Patient and Caregiver Connection. It's comprised of patient organizations that collect feedback from their communities at the request of the FDA, and then they share that feedback with the FDA, with the agency. The Total Product Lifecycle Advisory Program focuses on medical devices. And HDA is a collaborating partner in this particular FDA program. In this program, the FDA serves as a convener. So they will get a request from medical product developers or researchers saying, we would like to get some information from the patient community on their needs around medical product devices. We're a partner. They would contact us and connect us to the researchers or the medical product developers. The next category of FDA patient engagement is a one-time meeting. And these meetings provide opportunity for the patient community to speak directly to the FDA about their concerns. So a patient listening session is an informal meeting that helps the agency by informing medical product developers about patient and families' needs around outcomes, around preferences for treatment outcomes and clinical trial design. So during the meeting, the FDA listens, or they could ask questions. These meetings are between the FDA and the patient advocacy organization, the patient community only. No one else attends those meetings. They're typically 60 to 90 minutes. The second type of meeting is the patient-focused drug development meeting. I'm going to... And they're designed to engage patients and elicit their perspectives about the most significant symptoms of the disease, the impact the disease has on daily life, and current approaches to treatment. So this input can inform the FDA's decisions and oversights during a new drug development and during their review process. These meetings are half-day events. They are 4 to 5 hours, and attendance is open to all the stakeholders, to the FDA staff, to medical product developers, to researchers. So unlike those listening sessions, everyone can come. But the important part is the participants is you, the community. You are the participants in the meeting. They are the audience. So there's two types of meetings, one that is implemented by the FDA and one that is made upon the request of a patient advocacy organization. And that's what's called the externally led patient-focused drug development meeting. So the FDA decides what diseases they want to highlight for a patient-focused drug development meeting. It's up to the patient advocacy organization if they want to have a meeting on a specific topic. And so you submit that application, and again, it's up to the discretion of the FDA whether or not they will have that meeting. So as I shared earlier, the FDA has granted us the opportunity to have an externally led patient-focused drug development meeting. It will be held November 13th in College Park, Maryland. And as I said, the audience is the FDA and medical product developers, but the participants are you, the community. We'll have, we drive the agenda. We will have 6 panelists representing patients and family members. And you can join us virtually or in College Park. So, as I keep saying, as I've said, this is a one-time opportunity. But I just want to share with you, this is the first time the FDA has ever agreed to support another patient-focused drug development meeting. So this is a first, folks. They have never had a patient-focused drug development meeting for the same condition twice. So the FDA hosted a meeting. The FDA hosted their own patient-focused drug development meeting in 2015. And that meeting focused on late stages of Huntington's disease and symptom management because past clinical trials were really focused on symptom management in those late stages. So the endpoints for those clinical trials were really around motor skills. But today, as we learned in our session this morning, the clinical trials focus on therapies that intervene in HD at earlier stages. So as a result, those motor endpoints are no longer appropriate. So further, with the current advances in research, the focus of clinical trials shifts to a younger segment. As as Tracy was saying, that often HD strikes at people in the prime of their lives. So those earlier stages of the clinical trial work is focusing on those earlier stages. And so that community has very different risk and tolerance, benefit risk and tolerance considerations than they do people who are at the end stages. And I would just also say additionally, clinical trial participation may not be top of mind in the HD community who are not yet experiencing symptoms. So it was for all these reasons that the FDA said, yes, we think there should be a second meeting for the HD community for a patient-focused drug development meeting. So you've been hearing about Power HD, and I'm going to tie it into everything that I've just talked about today. So one of the things that we will share in that survey, when you take that survey, and that we will share at that externally led patient-focused drug development meeting, is the challenges of participating in clinical trials. And we need them to understand that new and better innovative ways to design clinical trials is important to the HD community. So clinical trials are typically composed of two groups. One group receives the therapy, and the other group receives the placebo. That's called the control group. By sharing with the FDA the community's challenges, we're able to explore with them the use of natural history data as the control group. And that's extremely important. I see people shaking your head. Just to make sure you understand, natural history refers to the progression of a disease in the absence of treatment. So when you participate in Power HD, you're sharing them with, you're collecting data about the progression of the disease. When that data is robust and rich enough, the FDA would consider using that instead of the control group for a clinical trial. So what does that mean? That means that if a clinical trial needs 100 people to be participating as the members that are receiving the therapy, and they need another 100 participants receiving the placebo, they need to recruit 200 people, right? But what happens if they're using natural history data? So this is why it's so important. This is why it's so important that you take the survey. This is why it's so important that you participate in the externally led patient-focused drug development meeting. And this is why it's so important that you participate in Power HD, because these are real things that you can do today to further innovation in the development of new therapies. So in closing, I just want to say, mark your calendar to attend the HDSA externally led patient-focused drug development meeting on Wednesday, November 13th from 1 to 5 p.m. in College Park, Maryland. It will be a hybrid meeting. We will have it as a hybrid meeting to accommodate as many people as possible. Those attending virtually will definitely have the opportunity to participate. After the panels discussions, will be open forum for people to participate in polling questions. People who are there in person, they'll be able to have a microphone and talk about their experience, but we will also be able to get your information from you online and read your responses to the questions that we're asking. So we hope that you will all be there on November 13, whether that's in person or virtually. And at this point, I'm going to ask Tracy to come back up, and we will open it up for questions. I don't have a date for that yet, but if everyone goes to the HDSA website, you know where there is the campaign information, and that will be posted there. It will also be posted in the Advocacy Take Action newsletter, in the June newsletter, which will be coming out in about 2 weeks. I'll have that date for you. But it will be available. You do not need to attend it in person. It will be available.
That's a great question. I should repeat it for our live stream, is using social media and using hashtags. In the past, when we were doing the Parity Act, anyone who knows about the HD Parity Act, we would do hashtag HD Parity Act or HD Insurance Disability Act. Currently, we do not, and that's probably something we should talk about at our next meeting, and we will come up with a list for you guys. That's really good, and maybe for each legislation even. Yeah. But in the meantime, you could just hashtag HDSA, or oftentimes we do a hashtag Cure HD as well, is another one.
So one of the first things that I did when I joined, repeat the question. So she was asking, how does HDSA decide what their portfolio of advocacy is? And as I shared in yesterday's presentation, we did a survey asking the community to tell us what their priorities are. And so then based on those priorities, we looked at 4 priorities that the community shared with us, and we looked at the federal legislation that ladders up to that, those priorities. So you see when the handout that you have there is a talking sheet about the legislation and how it pertains directly to HD. At this moment, HDSA is not involved at the state level. Our focus is on federal legislation.
Can I just add, though, we do have information of people affected and how many people have HD and are affected that we know of in each state. So that might be helpful for you when you're talking to someone on a state level. Like here's how many people are affected in Texas with this disease. How many does it affect when you add in the families and mothers and grandmothers and all, everyone in your family. So those numbers can be very helpful when you're speaking to somebody. By state. No, but it would be, but it is pretty helpful when you're talking to, one of your state officials about like, here's our numbers in this state. A lot of times people don't realize that, that there's this many people that it affects. So, you can reach out and get that information from us. So if you want to talk to them, that it always helps.
Yeah, right back there. So there'll be more information about how to register for that meeting on HDSA's website. I apologize, I don't have that information before the convention. We just got approval from the FDA, so it's late breaking news that we got the November 13th date. But trust me, when I come back from convention, I'll be working very hard to get all of that information out to everyone.
Anyone else?
Just to follow up on
Sure.
the state information, is that available on the website?
I don't believe it is. It's something that I worked, I'm sorry, I should repeat the question about having the state information of how HD has impacted each state. It's something that I worked on with somebody at the national office, so I don't think it's on the website anymore, but they do have that information.
Well, just to say, if there's a desire to drill down to a narrower audience, really the way you can do that statistically is just to compare your population statistics.
Sure,
Right.
absolutely.
So you have a state number, and then if your area is a certain percentage of the population, it's not a perfect number. but
No.
it gives you a picture.
And yes, and I have done that too. That's a very great suggestion. We know what the percentage is, and you can take your own state, and it's not perfect, but it certainly gets close enough. So the question is, are there ethical issues with people in the federal government lobbying? That is not my purview. That's their purview. I would not be able to address questions on whether someone in local, state, federal government, how they are, what the rules that govern their ability to lobby, because I don't work for the government. So, but good question. Right. The comment was that while HDSA doesn't have the bandwidth with just one person, Phyllis, to cover all 50 states, that I have certainly reached out. When people reach out and ask for advice about some advocacy tips about work that they're doing in the state, I am more than happy to counsel and provide that insight. It's just that I don't have obviously the bandwidth to really be there in your state organizing for you.
There was one question in the back.
A comment on the federal government piece. Each department of the federal government, for those that work there, there's ethics officers that can be consulted and just put the issue up, and they'll let you know if that's okay to do, like to advocate. And then a question, the information about the state information, how many people are in your state potentially, is that published yet? I know I heard you say that you have that information. If we'd like that, do we reach out to you?
I do not have that information. HDSA doesn't publish that. We were suggesting that it's easy to back into it when you know the population of your state and we know the percentage of people living with HDSA, that you can back into a number. But we do not have that information for each state with the number of people. All right, any other questions? Well, we thank you so much. Oh, go ahead.
The question is, you spoke about Power HD toward the end. Is there anything that anybody could do right now, or do we just wait for that survey?
No, so there's two different, there's the survey, which is
Right.
the HDSA's Symptom and Impact Survey. Power HD is the initiative that we kicked off at the convention here. There is a booth, a table. It's not outside here. You have to take a left when you get to the corner. There is a booth there for Power HD, and I would encourage all of you to go there and at least get registered. I think at all the sessions there is a QR code. There was that QR code today at the session where you can get information about Power HD.
Okay, thank you, Phyllis and Tracy, for that important clarification.
Ron. So Ron was sharing that it's the login for Power HD. The link to Power HD is in the app. So please go out there and do that. So I'm asking you to do two things. I'm asking you to take the survey, the HDSA survey, but I'm also asking you to sign for Power HD.
Just want to quickly say that there have been a couple of words used, and I want to make sure people understand the difference between lobbying and education. And what we're doing is education.
Right.
You know, we're not paid lobbyists, we're
Right.
constituents, we're not
Right.
paying to influence, we're educating. And that's a really important distinction for those of us who represent nonprofits.
Yes,
Absolutely.
absolutely.
Thank you for that.
Thank you. All right.
Great, thank you guys.